This conference will now be recorded.
Good afternoon, everyone. If you don't mind muting yourself, I'm trying to mute everybody, but if you're on the phone, if you can mute yourself, that would help reduce background noise. I want to welcome you to today's webinar, School Safety Precautions During COVID. This is being presented by the Office of Public Instruction and Department of Public Health and Human Services. If you haven't already, if you don't mind typing in the chat box your school district name of your attendees, one email address for your school, or maybe the director of the school nutrition program. And then if you're participating by phone, please email me at bark@mt.gov to receive a copy of the handout or the presentation slides link, or if you want any more information. I did put in the chat box the link to the handout that we will be basing the information we're providing today from. So if you want to bring that up, it's up to you. It's been posted. It's a education supplies and student meals during COVID-19 handout that went out this week on several listservs and on websites, and it is on OPI's website. But in case you want to take notes on it or anything, feel free. So we really want to welcome you to this professional development opportunity. It will be 1 hour, so there'll be 1 hour of professional development credit available for it. It is being recorded, and the URL or link to the recording will be available in the MAPS program for school nutrition program professionals, and then also on the YouTube channel for Montana Team Nutrition. We will have plenty of time for questions and answers at the end. And so as we're going on, if you have questions, please put them in the chat box, and we will make sure that we try to answer them to the best of our ability, or get back to you on them. First of all, we just want to thank everyone that is helping keep kids fed and educated during this stressful time. You are truly everyday heroes. This cartoon from Gary Varvel really says it all, shows how school personnel, obviously medical professionals, grocery store professionals, everybody's teachers are on the front line. So we just want to give a really big shout out of thanks to everyone. We really appreciate you taking the time today to learn more about safety precautions in respect to handing out educational supplies and the service of school meals. I do want to give a shout out to Ms. Dale Hayes, registered dietitian, and co-facilitator of School Meals That Rock, Facebook page, Instagram. She has just been a great source of obtaining accurate information and ideas from around the nation, which has been really helpful. I also want to give a shout out to my peers at the Office of Public Instruction School Nutrition Program staff. They've been working very hard to assist schools, and we really enjoy working with them. In today's webinar, what we hope to make sure you know about is how to follow good safety precautions when providing educational supplies to schools, meal preparation and service, provide plenty of time to answer your questions, and then provide some resources and announcements. Today, Holly Mook, if you know her, she's the Coordinated School Health Unit Director. She's was going to be co-presenting with me today, but she was called away. But I did want to give a shout out to her because she has been helping with really coordinating school health activities around this topic at OPI, and just wanted to thank her. My name is Katie Bark, and I'm a registered dietitian and project director for Montana Team Nutrition, which is located at Montana State University in Bozeman. We have the honor to work in close collaboration with OPI school nutrition programs in providing training and technical assistance to food service professionals, educators, and school administrators around a variety of nutrition, education, farm to school, and school wellness topics. Today also, people on the call that will be able to provide information are the school nutrition program staff. You may know Christine Emerson, Camille Bazzaro, the assistant director. Kim Lloyd will be really providing some answers to your questions about the operations of a summer food service program. Deb Jones is one of the 6 school nutrition specialists that will also be able to provide some answers. And Pam Frew, who's food distribution program manager. So they are all going to be on the call. And so if there's specific questions beyond this topic, we want to make sure that you get answers, so they will be able to assist. Our colleagues, our peers at Department of Public Health and Human Services in the Communicable Disease Epidemiology Department are here with us. So we really appreciate you providing the information on the educational supplies and maybe answering any other questions. Jennifer Miller, who is a registered nurse and has worked a lot in nursing. Her title is Communicable Disease Nurse Consultant, and she's also had experience in school nursing at Dawson County. So she'll be presenting in just a few minutes. And then some of her colleagues in Food and Consumer Services also are on. Ed Evanson, Alicia Love, and Eric Lee will be available to provide any food safety answers. As you know, registered sanitarians are, your county sanitarian is your go-to person for food safety, so we really appreciate that you're on this webinar today. Okay, I'm going to turn it over to Jen Miller, and she will be going over this delivery of educational materials. Jen, let me just unmute you.
All right, I'm hear me?
Yes.
Oh, very good. Thank you for the opportunity to cover this subject today. I know this is very near and dear to everybody's minds right now. One thing I want to make immediately clear to everyone is what's driving the transmission of SARS-CoV-2, which is the virus that causes COVID-19 disease, is person-to-person transmission. Meaning you catch it because you have close prolonged contact with another individual, and that means within 6 feet for longer than a brief interaction. So while that's what we're seeing where most of the infections are happening, a fomite transmission is possible. So a fomite is anything that is an inanimate object that has come into contact with a potential pathogen. So the subject of textbooks is something that I can understand why educators are very concerned about, because a lot of kids are handling them. I've worked with a number of schools in the past, and you know what? They're not the greatest hand washers, so I understand the concern. So let's go. We want to talk a little bit today about what to do with textbooks and materials that you need to share. So textbooks, they're challenging to disinfect because they're not really a sanitizable surface. They absorb liquid rather than wiping off and drying. And it will damage your books and make it impossible to use in the future. So we don't recommend disinfecting textbooks, and we don't recommend sharing textbooks if that's at all possible. If the best option you can use right now is to copy and distribute necessary materials to your students, so it's a one-time use thing. Can you move to the next slide, please? Okay. All right, so as a last resort, if you must share books, and I imagine many of you will find yourself in that position, there are a few things that you can use as guidelines. If possible, you can put the book off to the side for about a week in between uses. That would be ideal. And the reason being, these pathogens, while they can persist for a little while, they don't persist forever. And so since you cannot otherwise disinfect that book, if you put the book off to the side and not use it for a while, then it negates its use as a vector for your pathogen transmission. So it's not going to jump off the book to other people after use, right? The other option you can is the most heavily touched portion of that book is going to be the cover. So if you laminate the cover of the book and disinfect it and limit its use to 2 to 4 students, that limits its possibilities in being something that we find that will infect students. So you have just 2 to 4 students using it. Encourage hand washing for all these filthy little animals that we love. You know, they're kind of got grubby hands sometimes. But if you laminate the book, that makes it a sanitizable surface. Could you go to the next slide, please? Okay. In summary, we just want you not to share the materials if possible. For example, if a math book was needed by 8 students and only 4 books were available, then you can use each of these books in a manner where you can limit its use between 2 to 4 of them. And if you have the sanitizable surface, that will cut down on risk. You do need to follow CDC recommendations on using face masks and for hand hygiene as well. And those recommendations are available online. I can certainly put the links to that information in the chat if you would like. So that's all I have for you right now. Are there any questions at this point?
Well, Jen, I think what we'll do, most people don't have microphones, so they'll put it in the chat box. So would the question and answer time, if we can take the questions then.
Okay, all right, I'll hang out.
Thank you.
You're welcome.
Okay. So the next topic will be about child nutrition programs and the handling of, delivery of school meals. So as you know, child nutrition programs are playing a critical role at this time to ensure kids are fed and ready to learn. And I guess we just want to again thank schools from across the state on the hard work that they are doing to really help feed kids. These are some pictures of Knoxon school meals. And the top right salad is a Montana beet daikon radish slaw that Louise Chandler and her staff gave samples to their families this week as an example of just having them be able to enjoy a refreshing Montana salad. Schools around the state, like Stevensville, Glasgow, they're providing a lot of grab and go meals, obviously only grab and go, from salad, sandwiches. And as you can see, Stevensville, they are practicing the 6 feet rule, which is awesome to see. And Livingston, I've been getting these pictures from Facebook. So if you have any pictures to share, please send them to us. We'd love to see them. Livingston has been working hard on providing grab and go meals along with education on Montana foods through their farm to school program. So I'm going to review the food safety precautions, and they are listed here. I will go through each one of them. And the handout, which I put in the chat box, is also listed here if you want to follow along. And we will go over these things: staying 6 feet away from each other, or what's known as social distancing, recommended hygiene habits, which includes proper cleaning of surfaces, and point of service to practice hands-off contact. Now, as you, most of you guys are school food service professionals. As you know, you have been trained in food safety through the ServSafe program or another approved food safety program. And so you want to continue to practice those same recommended food safety practices. Just like it's documented in your school HACCP plan, you will provide, you'll just follow those standard operating procedures. I did want to just highlight a few of them today because, the delivery, people have asked about what happens, how should I handle my delivery of items, when I get my food products in. So we'll go over that. Meal preparation, meal service and delivery of meals, and cleanup. So as you know, the standard operating procedures, they're listed on the Institute of Child Nutrition. You have them in your HACCP plan, but I wanted to make sure you know that they do have a COVID-19 resource page, which has excellent resources that if you're using this, if you're training some of your staff, or maybe you're training people that aren't normally delivering meals, like bus drivers, and you need some resources, I'd recommend you to go to this website. They have posters on videos on hand washing, and obviously all the standard operating procedures. The Kansas Department of Education developed a standard operating procedure for viral pandemic response, and it is posted at this website. So you may want to look at that. So when you're receiving the delivery of items like your USDA foods or your Montana products or food, from your distributors, we did want to go over some recommendations, which Jen, I think if you want to comment on this after I'm done, feel free, because it is similar to obviously textbooks as far as their materials that you receive. So it may be possible that a person can get COVID-19 by touching a surface or object like a packaging container that has the virus on it, and then touching their own mouth, nose, or possibly eyes. But this is not thought to be the main way the virus spreads. In general, because of poor survivability of these coronaviruses on surfaces, there's a very low risk of it being spread through food packaging. But in order to, again, prevent any kind of risk, you want to practice proper safety precautions as listed here, as far as, and this is where you would be wearing a mask while you're doing this also, but staying 6 feet away from each other when you're receiving the items, staying 6 feet away from the delivery person, obviously, or when you're putting the food away, staying 6 feet away. Making sure you're properly washing your hands, properly wearing gloves and a face mask, and wiping down packages with a solution, and washing your hands after putting items away. So this is where you can just reduce the risk. And this information was actually provided by Pam Frew, the food distribution manager for OPI. Some of the practices that schools have been following is designating a receiving area outside of your building, setting up a table or laying down a tarp to make sure the items are delivered there, making sure the driver knows where they should unload, having a sanitizing station set up near the delivery point, and communicating to your driver that, as you unload, we will sanitize the cases, move them inside, making sure communicating, staying away, and as you're also have a mask on. And again, schools are setting up procedures that work for them to follow these procedures, especially during modified school hours or if there's reduced staff in the building. Making sure, again, you're communicating to the delivery and including a cell phone number. So I think if Jen or one of the Eric with the registered sanitarian, do you guys want to comment on this topic anymore? Because you guys are the experts.
This is Jen. I think you have the key management points up there. And one thing I want to reiterate too is there is no evidence of transmission within packages from either coming from China or from other parts of the US. So I just want to make sure that that's put out there. You know, the type of objects that I would be far more worried about infecting somebody from a surface would be like vape pens and hookahs and things like that, where you have direct saliva contact on there. I know some people chew on their pens. That might be one that's a little more high risk. So just keeping in mind that kind of stuff. Packages, we want as little risk as possible, and so these are good guidelines to reduce any sort of risk that might be there with these packages. Okay.
Thank you. Great. And if there's questions, we'll be happy to answer them in a few minutes. Okay, just a few things about meal preparation. Again, food service personnel, we are so proud of the excellent food safety practices you follow. You want to just keep following those. You want to obviously stay home if you're sick, practice good personal hygiene, keep cleaning and sanitizing surfaces correctly. Hand washing is obviously key, proper use of gloves, and now mask is a new thing. Keeping hot foods hot, cold foods cold through temperature control, time, and staying 6 feet apart is a new, obviously, recommendation. And this is where the 6 feet apart from each other, or what's called social distancing, is what I wanted to just show some graphs that are available from Lunch Assist that really shows how you can stay 6 feet apart in when you're preparing food or delivering food. I think with the addition of, these were diagrams that are available on the lunchassist.org website. They were done before masks were recommended, because as you know, things are changing, seems like by the day. But if you're wearing masks, especially if you're in a small kitchen and you can't, you know, staying 6 feet away may be hard sometimes in your small kitchen. Wearing a mask is vitally important, and we'll go over that. But as you can see in this diagram, when food preparation is occurring, trying to set up your space workstation 6 feet apart to avoid any physical contact with each other, and then obviously sanitizing hands and surfaces regularly. Again, just another showing somebody doing dishes while the other person is maybe handling the food, 6 feet apart. During the point of service procedures, you know, that's the delivery of the meals to the parents, the guardians. Again, practicing no contact, hands off at all delivery sites. Some schools are using traffic cones outside to space them out at least 6 feet apart, or putting blue tape, or, you know, some kind of masking tape or duct tape on the floor. Transferring only enough meals for one family to pick up at a time. So again, not having any contact, and frequently sanitizing hands and surfaces. So if you were using a multi-purpose room or a room, you know, area right by your front door or outside your school door, this is just an example of showing having people 6 feet apart. Walking up, meal service, again, this is showing that you have a table, that the parents stay 6 feet apart while they're in line, sort of what's happening when we go to the grocery store now. And then the staff are staying 6 feet apart, and they're allowing one family to pick up a meal at a time. So again, they're staying away from each other. I know it's really hard because the kids sometimes, if they're with the parents, they want to give you a hug. You just sort of have to tell them you want to give them an air hug at this time and give them a big smile. So I'm sure it's breaking your hearts not to hug them, and them theirs too. But it's good, important for all of us to stay safe. Drive-through meal service, again, just showing that you don't want to be putting, you know, reaching into cars, that allowing the parents to get the meal, you know, the sacks, while you're 6 feet apart from them. If you're using a food truck or a school bus, again, setting up an area that the students or the parents or guardians can pick up the meals one at a time, so they're trying to stay 6 feet apart at least. Home delivery, again, not going into the don't go into the home, but actually delivering it so outside and 6 feet apart. So those are just some examples of how to, really implement the 6 feet apart social distancing recommendation. And I guess when some people say, how much is 6 feet? How far is 6 feet apart? I think if everybody sat up and put your arms out to the sides, and if you had your arms out and then somebody was next to you and had their arms out but not touching, that's about 6 feet. That's a good visual. Or it's probably the width of an SUV car. I don't know if anybody else has any other good analogies for 6 feet. They can put in the chat box, but trying to, again, stay at least 6 feet apart. Okay. When we are actually, again, talking about meal service, as you know, food, temperatures are important. And these are food cards that are available also in English and in Spanish. All of the materials are usually available in both English and Spanish. And then we realize that some schools now are providing like 5 meals at a time, or giving 3 meals or a couple meals at a time. So they may want to put a label on it. While it's not required to put a food label on the grab and go meals, some schools are doing it and putting some information on what the food is, and then just some food safety information on making sure that they don't eat it right away. They freeze the food, or eating them, or discarding the foods within 5 days. So again, just keeping food safety in mind. Hygiene habits. This is where, obviously, the first thing is staying home if a person's sick. And this is where I don't know if there's going to be any discussion on school schedules, of scheduling of staff. We have heard some schools have split their staff up, so they aren't all working at this time. So they can obviously spread out in their kitchens, but also that way, if somebody's sick or gets sick or has been exposed to somebody that's sick, they're not working. So the first thing is to making sure that you stay home if you're sick or been exposed. And then the proper hand washing frequently. And if you can't wash your hands, like if you were delivering meals on a school bus and you had to use a approved sanitizer, that's very important. But keeping your hands clean is so important. And then the proper use of gloves, clean aprons, and masks. And that's where, as you know, you can contaminate gloves or masks so easily if you are, using gloves to touch things, or using touching your mask with your hands. And that's where, with dirty hands. So the proper use of gloves and masks is really important, which you as food service professionals are very versed in, but just want to emphasize that. With aprons, either using, disposable aprons, or obviously having them cleaned each day. So those are the hygiene habits. This is the recommendations from our National Health Department, which, as you know, is called the Centers for Disease Control, or CDC. And masks or cloth face coverings are recommended to help slow the spread of COVID-19. And it's, I took this text right from their guidance, because it says, wear face coverings in public settings where other social distancing measures are difficult to maintain. And this is where I think you have to gauge if you're able to keep 6 feet away from your peers in your kitchen, or if you're not. That's when, wearing a mask in your kitchen may be recommended. These masks should not be surgical masks or N95 respirators masks, because those are reserved for healthcare professionals. And on their handout, which we will, I think we put the link in the handout, and we can put the link in this chat box if it helps. There are 3 mask patterns that you can make without even a sewing machine. You can make it from a t-shirt, because cotton is really good, or you can make it from a bandana or cloth. So there is information there. So making sure that if you're going to wear a mask, that it's effective And in doing that, it needs to be worn properly and cared for properly, as far as in combination with frequent hand cleaning with soap and water or an alcohol-based hand rub. Worn properly, and we'll talk about that in just a minute, and obviously put on and taken off properly or stored properly. So it's very important, just like as you know with using gloves, you want to treat masks the same way, as far as you don't want to get them contaminated. Was going to show you an Eat Real. There's a great, if you're looking for video, again, you can't assume people maybe know this. There's a short video by a pediatrician from the Eat Real organization on YouTube. If you just Google it, or make sure we put this link in the chat box on how to wear a mask. This is a handout by Lunch Assist that I put the link in this PowerPoint. I'm just talking about how it's easy as 1, 2, 3 to put on a mask properly. First of all, you clean hands for 20 seconds with soap and water or a hand sanitizer. Inspect the mask and check that it's clean and there are no tears or holes. Determine which side of the mask is the top and which side is the front. You put the mask over your earlobes, hold by the ear loops and place around each ear. Or if it's with ties, you would hold by the ties and bring the mask to nose level, secure the ties with a bow behind your head. And then if they're bands, you can pull the straps over your head and secure comfortably. But you want to make sure the mask is over your nose and your mouth. I found when I've been wearing it outside to go take a walk or go to the grocery store, I wear glasses and sometimes it fogs up as in the morning. And so what I understand, it's been getting warmer, so it hasn't been fogging up as much, but you can use shaving cream, they say, as an anti-fog vinegar, or there is this called CAP anti-fogging solution. So if anybody has any ideas, or if anybody's had any issues with wearing a mask and any solutions, we'd love to hear from you. So when you're properly removing or storing and disposing of masks, this is where, again, you don't want to contaminate it. So you want to clean hands before removing and do not touch the front of your mask. So with, depending on if you have masks with loops or ties or bands, you want to just hold both of the loops and gently lift and remove the mask. And then you usually either are going to, if it's a single-use mask, you may throw it away, or if you're going to clean it, a fabric mask can be cleaned with soap and hot water after each use, and or stored in a single use, or fabric mask can also be stored in a paper bag and then reused after 3 or 4 days. And obviously replace the single use mask if it becomes dirty, damp, wet, or hard to breathe through. I just wanted to give an opportunity either for Jen or one of the sanitarians if they have anything else on masks, because I know this is a new topic, and want to make sure if you guys have anything else to add.
I don't have anything to add at this time. I think you covered it well.
Okay, anybody else? Okay, just to go over it, and this is where, I don't know if I haven't had a chance to check actually the chat box yet for questions, but I know with keeping staff healthy and making sure that, you're just checking in with your staff. This is a handout from Lunch Assist, just talking about having a daily check-in, because I think everybody's under so much stress right now that sometimes, I know with our staff meetings we've been having each week, it's really nice just to have some time to chat and really process and share at this time, and check in with everybody. But with the check-in, you might go over how did the last meal service go? What are some things we want to do differently maybe, or any feedback from the parents when the delivery person, in the delivery process. How can we better support each other? What can we do to feel more safe? And how is everybody feeling? And that's where I guess This is where some schools I know, Livingston was taking temperatures to make sure everybody was feeling well, and that, but checking in, and depending on your staff, if you're rotating staff, I know in some other professions, they're having some of the people stay off for 2 weeks and then go on in 2 weeks, you know, and rotating their staff. Okay, right now I'd like to open it up to questions, and this is where I was going to unmute Deb and Kim and anybody who, you know, a sanitarian, just unmute yourself, and then that way if there's questions, we can address them. So let's see here. Deb, I don't know if you've been checking the chat box. If you see any questions you want to, is there certain ones? Any questions? Okay. Maybe there's not any questions this time.
Looks like Marilyn Tapia had a question in the chat.
Can you read it? I have a hard time
She's
getting.
asking, what are the recommendations for meal service when school resumes either later this spring or in the fall?
Deb or Camille, I don't know if there are recommendations right now. It really probably will depend if they are still going to be grab and go or if it's normal, you know, service, congregate service. I'm sure, I don't know if we have those, if there'll be any recommendations different than, you know, if it will still be the 6 feet. Anybody, I don't have the answer to that question right now.
Anything I might say is purely speculation.
Who's
Go ahead,
this?
Eric.
Okay.
Yeah, sorry, that was Eric.
Okay. There was a question about what about papers going back and forth? Do you see that question? That would be for Jen.
Yeah, Eric actually responded to it in the chat saying, you know, just limit it as much as you can. It's pretty low risk, but in general, if you make handouts that are given to the students, I've seen some of the schools, what they're doing is they're doing the work at home and then they take a picture of it and email it back. That's one way, so you don't have to bring it back in. But if you're concerned about the handouts coming back to you, handling them afterwards, you can do the same thing you do with the books and put it off for a while and let it sit.
Okay. So there's a question on parents are concerned about packages being delivered to them. I print on Thursday and deliver on Mondays. When I deliver, I wear a mask and gloves and drop off outside the house. Parents want to know how safe it is for them to receive them. I explain the person to person that I do not breathe on any of the documents or touch. Any other suggestions?
I think it's good to explain that the reason that you're wearing gloves and a mask is to prevent any, you're having to have some closer contact with people to pass those out. So it's not so much you protecting them from the papers, it's you guys are protecting the workers from potential exposure from the families dropping off there. Does that make sense?
Yes, the way, I guess, are you saying that like if I wear a mask and you were next to me or, you know, within 6 feet of me, I would, by me wearing a mask, I'm protecting you. And if you're wearing a mask,
Correct.
you're protecting me.
Correct.
Okay.
So the
Okay.
paper, like I was saying earlier, it's not the papers and the fomites driving this outbreak, it's the close personal contact.
And that's where I guess in picking up meals, this is where I think, again, it's sometimes awkward, but you need to not have people hanging around. Because I know like with summer feeding programs, usually, you know, they were always eating there, but this is where it's important not to have the people hanging around either because of the contact, right? So. Is there not a concern about wearing masks and causing people to touch their faces more frequently? Any suggestions for that?
And I think that one was answered in the chat too. Eric, did you chime in on that one? I can't remember. I'm going back to it. Hang on a second.
I'm just afraid if people aren't looking in the chat and people that are on the phone, we want to answer
Right.
the questions so they hear them.
No, correct. I just want to make sure. I want to see what was said about it already. Okay, so there's a, like you covered earlier, there's a proper way to use your mask and don and off. People shouldn't be touching their faces anyway. Putting on the mask, you should follow good hand hygiene after you do that, right? So that minimizes the risk from actually handling the mask, and you should pull it off in the same way using good hand hygiene. So there was some side chat with Eric about some things that people were seeing, and I don't want to address that so much, but follow the good hand hygiene recommendations when you are donning and doffing the mask. That's my best recommendation.
And I guess I can relate that for myself. It does take, it takes some practice. I guess it takes some time to get used to wearing a mask. Because sometimes your nose is itching, so you sort of have to do it without touching it. But, and then making sure they don't fog up. I noticed like the cotton ones from a t-shirt is a lot cooler than when I've been making a mask out of a bandana. So if you have a hot kitchen, you might want to use more the t-shirt, cotton material than a bandana. Kathy Martin from Corvallis suggested using sidewalk chalk in the parking lot for directional arrows, welcome entry, exits, and marking 6 feet. Works great. Thank you for sharing that. Are there other questions that are key to go over?
Stacy Nelson asked, are face masks required or just recommended at this time? If you're in a workplace, your workplace may be the one requiring them. If you're going to be in like she was saying earlier, if you're going to have to be in a position where you're within 6 feet of other people, remember that's source control. You're putting it on yourself in case you might become infectious, or if you're infectious and don't know it. So that's the recommendation at this time. For the public, it's a recommendation, but there's no requirement from CDC saying that you must wear one in public. So just keep in mind there's a difference between a workplace requirement and then the public recommendation.
Okay, there was a question, and this might be for Deb. Is it best to get a waiver and continue with our regular program, or should we apply for the summer food service program? And I'm not sure where Carr Shepherd is from. Or Deb, can you address that?
Oh, Katie, this is Kim. I just suggested that she reach out to her regional specialist to talk through the best option right now. But I should say that there is a waiver to apply for anyone to operate the summer food service program outside of an eligible area right now. So if you are interested, that link will provide your regional specialist contact, and we can walk you through how to apply for the waiver. The nice thing about summer is you can serve to anyone 18 and under.
Thank you.
Mm-hmm.
Any other questions, or looks like we've answered all of them. Is there anything else, Eric or Jen? I was going to go over a few resources, but anything else, Eric or Jen or anybody want to say that I missed, or any other recommendations? Okay.
I don't have.
Oh. I think it sounds good to me.
Okay. Okay. Well, if you're looking for COVID-19 resources, I did put down our Department of Public Health and Human Services. They have a great Coronavirus Montana website. And then the Office of Public Instruction has information on their front page also. The Center for Disease Control, if you're looking for more information like on the masks or on handling, they have a wealth of information. And then the lunch assist is a school nutrition business in California that is really, they've got a blog also that's awesome, that has really been sharing a lot of resources. And some of their handouts are what I use today for some of the slides. And then I wanted to make sure, last week we did do that grab and go menu ideas and cycle menus webinar, which is posted. But if you're looking for any ideas for grab and go menus, there is a 4-week menu cycle that is an extension of South Dakota State. So we'll make sure if you want these slides, you can get these websites. For training opportunities, the School Nutrition Association at the national level is offering their Wednesday webinars free to anybody. You don't have to be a member. There is a food safety course that's available if you, let's say you had some people that haven't been trained in food safety and you want to have them do a course, there's one online. And then next week, our the OPI School Nutrition Program's Wednesday webinar is on April 15th, and Kim Lloyd will be going over summer food service program. So if you do have additional questions, be sure to be on that at 2 o'clock on Wednesday the 15th. And then we were going to start a school nutrition chat on Thursdays. Next week, it will be the first one. And we're trying to figure out what time to do it. And we were trying to see today if there were more people on at 3 o'clock versus 2 o'clock. Because we want to just have this hour time. That is, if you have a question about what you're doing right now, you know, somebody from OPI School Nutrition will be on, somebody from Team Nutrition, and then we were going to get a school food service peer educator on in case there's questions you have about how to keep food costs down or supply questions. You know, we were just going to be there in case you guys had questions. So we're going to start that, but I don't know if anybody has an idea of when's the best time for you, that you would want it at 2 o'clock on Thursday or 3 o'clock or in the morning. We didn't know what time. Please put it in the chat box because we're trying to figure out when is a good time. If you're looking for social media contacts, if you're willing to share your videos or a picture of what you're doing, please post it at the Montana School Nutrition Association Facebook page. If you're on Facebook, there's information for a farm to school if you're looking for like short videos to share with your teachers that they can use, the parents can use at home to teach about Montana foods. The School Meals That Rock Facebook page is excellent, and there's a tips group that you can join if you go to the School Meals That Rock, Dale Hayes. And then the Lunch Assist blog is there too. So those are just things if you're trying to get information or stay connected. We did find out a couple funding opportunities. Gen Youth Grant is giving schools emergency funding grants up to $3,000 to help get equipment. If you've had to buy coolers or transport material, you can look at that. We understand, and I didn't have the link, I apologize, for No Kid Hungry at the national level has some grants available. So if you're needing funding opportunities, you may check those out. And then this is, you know, there's a lot of resources coming from partners. This is one from School Meals That Rock that they did with Schwann's. And again, just some poster and communication materials if you are trying to make sure your staff are trained on the key elements. This is one that's available free. It's a PDF. And I guess I don't have anything else unless you have any more questions. We really appreciate you spending your precious time with us today, and we want to make sure we are here to answer any other questions.
There's one more question, Katie.
I have a question.
Sorry.
Yes, go. Just if you don't mind saying your name and where you're from.
Yeah, Craig Taft, Bighorn County Sanitarian. This is the first time I've been on one of these calls, so I was wondering if after this meeting concludes, where do you go? What website do you go to get all these links that you have up on the screen there?
We will post this presentation on OPI's
Oh,
website.
so you
If
just
you
do
put
it.
your email, if you put your email in the chat, Craig, I can just
Uh-huh.
email it to you.
Okay.
That would be the
Oh.
easiest. I'll email you this presentation and
Okay.
the handout.
Okay. Thank you.
Sure. Okay. Well, we really appreciate your time again. And if there's anything else we can do, please reach out to us and hopefully we'll be in touch next week, if not before. Okay, thank you guys. Have a great rest of the day and stay well.